It all depends on position, okay? If the foreign body is able to be palpated, then it's quite easy to remove. But nowadays, with the availability of ultrasounds, we tend to use ultrasounds virtually all the time in foreign bodies because you can localize the lesion very well. Somebody stands on a needle, it's very hard to localize the lesion in the sole of the foot without an ultrasound. So ultrasounds have become really the investigation of choice for foreign bodies. If you can see a foreign body, then you remove it. If you can't see it and you can't feel it, then you've got to do an ultrasound. The most interesting and fascinating foreign bodies, of course, are foreign bodies that end up in the rectum and further up, and these are often as a result of sexual activity, or it may be just a funny thing that the patient likes to do, but occasionally you can lose equipment in the rectum. You can lose equipment, obviously. You can swallow things, and we've had a patient recently swallowing razor blades, and that's not an uncommon thing, unfortunately, and that's a psychiatric problem. I had a patient who came who had some mucus discharge from his anus. When I examined his anal area, it was open. Okay, so obviously something had been in there. So I did a rectal examination and I could feel something in there, but I couldn't get it out. So I suggested to the patient that he have a colonoscopy, which I was able to do not in my office, but downstairs from where my office is. And on colonoscopy, we could see a dildo, but we couldn't put a lasso around it to pull it out. So we admitted this patient to theatre. We then ended up having to do a laparotomy, in other words, open the patient up, and we had to pull the dildo out through the transverse colon.